Good afternoon, everyone. Thank you for joining us. Welcome to the Tuesday edition of the COVID-19 Situation Report. We do have some construction noise going on, so if you hear some drills whirring in the background, that's what it is. So my name is Brittany Cadence. I'm the communication manager for Peterborough Public Health, and we're very pleased that you are able to join us today. We have a special guest. Well, we have Paul joining us, plus we have a special guest from Peterborough Regional Health Centre who we'll introduce later, but it's Dr. Lynn Mikkola will be sharing some remarks as well on behalf of our hospital. So to kick us off today, I would like to start us with a land acknowledgement. And as we look at this beautiful picture reminding us of sunnier times, okay, we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so let's move on to hear our opening remarks from the Board of Health Chair, Mayor Andy Mitchell. Please go ahead, Mayor Mitchell.
Thank you, Brittany. The local COVID-19 situation remains concerning. Last week, Peterborough Public Health reported over 100 new cases in a week. This is the first time this has ever occurred. Last week's total of 110 represented 9.92% of the total cases reported in Peterborough since the pandemic began. Everyone needs to focus. Confronting these numbers, I spent the weekend getting very frustrated. Not only because new provisions were constantly changing, but because governments, and many others, seem to be more interested in ascribing blame than in protecting us, our families, and our community. At a time like this, politics needs to be set aside. Blind adherence to ideology needs to be stood down. And the blame game needs to cease. If you're looking for a culprit, its name is COVID-19. Like everyone, I want a return to normalcy. But the only way to guarantee it is to defeat COVID, not each other. The way forward is clear. First, public health measures need to limit person-to-person contact in general, and more specifically within indoor settings, like crowded workplaces and congregate living locations. Government must provide people who are ill or likely to become ill the financial support to stay home. Last February, Peterborough Public Health petitioned the Premier to introduce paid sick leave during the pandemic, and I believe that this continues to be a priority. Second is to roll out vaccines as quickly as possible. Alone, they will not eliminate the third wave, but they will help to blunt it, protect vulnerable individuals, and avoid a fourth wave. Canada's rate of vaccination, based on the last 7-day rolling average, is reported to be ramping up. But that will only mean something if each and every one who is eligible to be vaccinated does so. Third, each of us, regardless of any particular regulation, must practice good common sense pandemic behavior. Do not assemble in groups. When you are out, maintain a physical distance of 2 meters and wear a mask. Stay away from others if you feel sick or have been exposed to someone who is sick. As I said last week, there will be lots of time to dissect and understand how we arrived here, to assist on accountability, and to take measures to avoid future mistakes. However, today is not that time. Now is the time to come together, the time to introduce evidence-based public health measures, time to get vaccinated when it's your turn, and time to use our actions to protect ourselves, our family, and our community. Stay safe, be well, and in all things, be kind.
Thank you very much, Mayor Mitchell. Okay, we are now going to review where we stand in terms of local case numbers, etc. So I'll invite our Medical Officer of Health, Dr. Salvaterra, to explain what we see here on the slides. Please go ahead.
Thank you, Brittany. Hello, everyone. As of 4:30 p.m. Yesterday, we had 123 active cases here in Peterborough, and that is 16 fewer, fewer than we reported on Friday. Most of these continue to be variants of concern. The number of high-risk contacts has dropped by 115 individuals and now stands at 306. While these numbers are starting to go in the right direction, last week's record-breaking case count will still be felt for weeks to come. Our team of contact tracers have been working tirelessly to connect with every single high-risk contact, to advise them of their need to self-isolate and to get tested. Contact tracing and case management are the first line of defense to containing an outbreak. As we've already mentioned, other PPH staff have now been reassigned to assist in this effort, as it is all hands on deck. The longer it takes us to reach a high-risk contact, the greater their chance of spreading the virus. I wish I could show you what it's like, but behind the scenes, I am witnessing truly heroic efforts from my staff who are doing their absolute best to rise to this challenge. Fortunately, you'll see there has been no change in the number of local deaths due to COVID-19, which remains at 12. Next slide, please. As you can see on this bar graph, we reported 112 cases last week, which superseded the previous week's total of 81 cases. As Mayor Mitchell has noted, last week's total case count represented almost 10% of our total cases to date since the pandemic began. We should start to see this week whether or not the lockdown measures imposed on April 3rd are starting to have any effect. When we look at our monthly cases, you can see here that indeed April has achieved the status of having the most new cases reported in a single month. So far, 240 cases have been reported this month, with still 10 days left to go. On our next slide, we show you the breakdown by age and sex. So you'll see by sex, it's still evenly split, 50-50. In terms of the age bands, we can see that more than half of our total number of cases, or 567 of our cases, are under the age of 29 years. Our next slide shows you the exposures. So you can see here on the right-hand side in the last 4 weeks. And it's impressive to see, I believe, that 75% of all cases are linked to contact with another case. It certainly is a sobering reminder why socialization with members outside our household is now strictly prohibited. The number to watch in this slide is the proportion of cases that are categorized as community spread, and that has increased now to 17.5%. These are cases who don't know where they were exposed. There is no link. And it reminds us of why we must stay at home and only leave for essential purposes. Next slide, please. Testing continues to be busy. More than 48,800 residents have now been tested at least once, and this is 850 more than the previous week, which is notably higher than even a few weeks ago when only 400 to 450 people were being tested each week. Next slide, please. The number of outbreaks in our community has declined to 5, and they are occurring in a variety of settings. Staff and residents at Empress Gardens completed another round of testing yesterday, and those at the smaller congregate living setting will be tested again tomorrow. The number of workplace outbreaks have increased considerably over the past 2 weeks. We reported our first workplace outbreak at the beginning of January, and the next one did not occur till March 31st. But since then, 4 more workplace outbreaks have been declared so far in April. So lots has happened on the provincial front since we last convened. I thought I would provide a brief overview of the measures introduced by our Premier last Friday to strengthen the stay-at-home order. The key takeaways for our residents are that all outdoor social gatherings and organized public events are prohibited, except for socializing with members of the same household or one other person from outside that household who lives alone or who is a caregiver for a member of the household. Travel restrictions have been imposed at Ontario's provincial borders, and I would encourage everyone to respect the spirit of this order by limiting all travel outside their home. That includes travel in and around Peterborough. The provincial declaration of emergency and the stay-at-home order themselves have been extended for an additional 2 weeks to May 19th to help stop the spread of COVID-19. There have been further closures of outdoor amenities and some construction. As we have seen more workplaces becoming a main source of virus transmission, the Ministry of Labour is stepping up their inspections to ensure that public health measures are being followed. There have also been further reductions in retail capacity, with stores only able to operate at 25%. Yesterday, the province announced its decision to expand the use of AstraZeneca vaccine to anyone 40 years of age and over. I expect more information today from both the province, but also from the National Advisory on Immunization that has been reviewing the additional information on the occurrence of the rare immune events in order to issue its new recommendations on the safe and effective use of this COVID-19 vaccine. I would like to end on another positive note that our community can celebrate, and that is that this is National Volunteer Week. This week is especially important to us here at Peterborough Public Health because our mass immunization clinics are up and running smoothly thanks to the incredible cohort of 145 local volunteers. When we put out the word that we needed to recruit volunteers, this community rushed to the call. Our first task was to train them, and so far we have run several training sessions, both in the city and in the county, to orient these new recruits to their various clinic roles. Our volunteers help us with many important aspects of clinic operations. So far, they have screened thousands of residents for COVID-19 symptoms upon arrival, and they help residents move through the clinics. And while our volunteers may stand all day, by the end of September, they will have cleaned more than 58,200 chairs. So far, these volunteers have already donated more than 2,100 hours. We've calculated that by the end of the clinics, they will have donated more than 10,000 hours of work, which amounts to over 424 days. The total financial value of their time to our vaccination effort by the end is estimated to reach more than $275,000. This is an astonishing contribution, and we couldn't be more grateful for their wonderful support. When you arrive at one of our clinics, the first and last person you meet will be a volunteer. Please make sure to thank them. And now it gives me great pleasure to introduce my colleague, Dr. Lynn Mikula, Executive Vice President, Chief of Staff, and Chief Medical Executive at Peterborough Region Health Centre, with an update on how the hospital is faring. Over to you, please, Lynn.
Thank you very much, Rosanna. It's my pleasure to be here. As most of you are already aware, last week, Peterborough Regional Health Centre joined hospitals across Ontario in ramping down non-urgent care in response to the provincial surge in hospitalized patients with COVID-19. Over the last week, the situation across the province has continued to escalate. Across Ontario, there are now 2,360 patients with COVID-19 in Ontario hospitals, and 773 of these patients are now admitted to intensive care units. This is a substantial increase in hospitalized and critical care patient numbers since I last spoke with media less than a week ago. Today, we have 17 patients at PRHC who are positive for COVID-19. We've accepted a total of 46 patient transfers from the GTA, and 22 of those transfers have taken place in the last 3 weeks. This is a high and an accelerating volume of patient transfers, and it is out of the ordinary. It is also happening all around the province. At PRHC, we expect to continue to receive patient transfers in the coming days and the coming weeks, and we stand ready to help offload the pressure in harder hit areas. PRHC also continues to provide all life-saving services and care, and our emergency department is operating as usual. If you need hospital-level care, please come to the hospital or call 911. Enhanced pandemic measures, including temporary visiting restrictions, remain the same at PRHC. I want to take this opportunity to urge the people of our community to continue to follow the provincial stay-at-home order and all other public health direction. The hospital will do everything we can to support patients across Ontario to receive the level of care they need and also to meet the ongoing needs of our community. But we need your help. The best thing you can do is to keep you and your loved ones healthy by following all public health directions. Thank you.
Thank you very much, Dr. Mikula. Great to have you joining us today. And if you're able to stay for questions at the end, we'd appreciate it, but we understand if you do need to dash off. Now we will hear from our elected officials, and I understand that MP Maryam Monsef is on the phone, so I'm hoping she might be able to share a few remarks with us today.
Hello, Brittany. I'm not sure if you can hear me.
We can hear you. Go ahead, MP Monsef.
Perfect. Thank you so much. Colleagues, hello, bonjour, Anin, salam alaikum. I'm still in my basement on Mississauga and Anishinaabe territory, but I'm having some challenges getting my camera to work with MS Teams, so you'll just have to hear my voice. Let me begin by thanking Dr. Salvatierra, Chair Mitchell, and the entire volunteer and frontline health care workforce in our community. I know it is a difficult time for our province and for Ontarians, and I appreciate particularly the 10,000 plus volunteer hours that are contributing to our community getting out of this difficult time. I'll focus my updates on vaccine deliveries and timelines and make a quick comment about the budget, which was tabled yesterday in the House of Commons by Chrystia Freeland. everything that I'm going to say about vaccines basically boils down to this. Between now and the end of May, we were on track to receive 10 million doses of vaccine. Now we are on track to receive 10 million doses of vaccine from Pfizer alone, plus millions more from Moderna, plus Johnson & Johnson. This ultimately means more vaccines for more Canadians faster. I'll break that down a little bit. Regarding Pfizer increases, last week the Prime Minister announced that we've secured an additional 8 million doses of the Pfizer vaccine, the majority of which will be delivered over the next 2 months. 4 million of these extra doses will be received in May, which I can't believe is just 10 days away, meaning our weekly Pfizer shipments will increase from an average of 1 million a week to 2 million per week. 2 million more of these extra doses will come in June, with an additional 400,000 doses scheduled to arrive later in the summer, also now slated to arrive in June. This means in June, cumulatively speaking, we will arrive at 48 to 50 million doses of vaccine. There will be another 2 million doses in July, and we remain in regular contact with Pfizer and all our vaccine partners to continue to accelerate and increase shipments. On Moderna, we remain in contact with the team at Moderna, and despite the challenges they're facing with production, we do still anticipate receiving a significant majority of the 12.3 million doses originally scheduled to arrive by the end of June. I want to emphasize that these delays are delays and not reductions. For Johnson & Johnson, another piece of vaccine news over the past few days was the confirmation that we'll be receiving our first shipment of the Janssen vaccine developed by Johnson & Johnson. 300,000 doses of this vaccine will arrive over the next few days. This is a one-shot vaccine that can be stored with normal refrigeration, making it ideal to bring into hotspot zones with mobile vaccine clinics or other high-risk settings, such as food processing plants. Ultimately, the rollout will be up to the province, and we appreciate their hard work. And as the Prime Minister reiterated over the weekend, the federal government remains ready to assist with health and human capacity, with support on testing, and of course, ready to hear from provincial colleagues as they need additional support. Yesterday's budget focused on continuing to support provinces and territories in their response to COVID and supporting Canadians, strengthening long-term care, and supporting the mental health of Canadians most affected by COVID. Overall, the entirety of the budget focuses on those who've been hardest hit by COVID: women, youth, small and medium-sized businesses, and essential workers, low-income workers, while keeping our eyes focused on building the foundation for a recovery from the pandemic recession, and of course, building back better social, physical, and digital infrastructure, and improving our supports and safety nets across the country. I'm grateful to the team here in Peterborough, Kawartha for stepping up, and I will hand it back to you now, Brittany.
Thank you very much, MP Monsef, for that great update. Okay, joining us from the municipal perspective is our Mayor of the City of Peterborough, Diane Therrien. If your camera is cooperating, I'd love to put you up to spotlight you, Mayor Therrien.
Thanks, Brittany. Unfortunately, it's not cooperating.
Okay.
I don't have too much to add that Mayor Mitchell hadn't said. I know that everybody's frustrated, but we do need to treat people with kindness, especially people that are working in grocery stores and gas stations, and frontline workers who are dealing with a lot of really angry people. But keep in mind that these folks are working to help you go about your day and generally making minimum wage, and they don't deserve to be to be treated with disrespect and to be sworn at and that kind of thing. So save that for us elected officials. We'll take the brunt of that. In terms of, on the local front, the city is, working to ensure that our playgrounds and parks are safe and keeping up to date with the latest regulations. I'm supposed to have a call soon for all heads of council with the premier, so we're waiting on that. And other than that, I'll be happy to answer any questions after Brittany. Thank you.
Great. Thank you very much, Mayor Therrien. Okay, so now we have a chance to hear from our media guests on the line. I see that Matt Latour has his hand up. Did you have a quick question that we can help you with?
That was just because I was kind of on and off the call, so I wanted to make sure that it didn't get skipped over before the call ends.
Okay, great. Well, we've got you, Matt. Did you want to ask any questions of Drs. Salvaterra or Mikkola?
Yeah, so for Dr. Salvaterra, my first question has to do with, I saw on CP24 on the screen kind of while you were talking about the AstraZeneca vaccine, that Health Canada has now approved it for people 18 and over. Just kind of your reaction to this news and whether or not you encourage people 18 and over to get this vaccine once they can.
Yes, it's a good vaccine, Matt, and I understand that the province has updated both its pre and post-vaccine counseling information so people can make an informed decision. But it's an effective vaccine, and I would recommend to people that you take advantage of whatever vaccine you can avail yourself of, and if that's AstraZeneca, it's a good choice.
Oh, there we go. Sorry, I keep forgetting I have two buttons to press to unmute myself here. My second question has to do with, I saw that Peel Region has been issuing Section 22 orders to workplaces that have had more than 5 cases of COVID-19. I believe it's within the last 14 days. Is this something that could be a possibility here as well?
Not right now. We certainly don't have the same level of outbreak being fueled in workplaces as has been experienced in Peel. But I did hear from my colleague this morning. He did advise us that he was taking this action, and it seems completely legitimate given what they are experiencing there.
That's it for me. Thank you.
Okay, great. Thank you very much. Okay, let's hear from, I think Lance Anderson is joining us by phone. Did you have any questions today, Lance? Oh, we're not hearing you, Lance.
I don't know how to mute.
Oh, now we hear you.
Okay, sorry. Yeah, I'm good. Thank you.
Okay. Okay, let's hear from Paul Rellinger, who's also joining us by the phone today. Do you have some questions for our good doctors? We're not quite hearing you yet, Paul. I know it's tricky by phone. It's showing you're unmuted. Why don't we can come back to you, and but keep trying, or if you wanted to send questions in the chat thread, that's another option for you. Okay, we'll come back to you, Paul. How about Joelle Kovac from the Examiner? Please go ahead, Joelle.
Okay, so I'd like to start by asking if Dr. Mikkola can repeat the number of patient transfers. I'm sure she just said that and said how many were, what proportion were in the last week or so, and I just want to make sure I heard her properly.
Thanks, Joelle. So 46 patient transfers in total, with 22 in the last 3 weeks.
Okay, and you said you have 17 in ICU right now?
Currently, we have 17 patients with COVID in the hospital.
Oh, 17 with COVID in the hospital. Okay. All right. Now, is there, I know that there are provisions made to allow a field hospital to be set up at the Evan Root Center. Is that looking like it's imminent, or is it not?
That is a few stages down the road of our surge plan. Right now, what we're doing is creating extra ICU capacity within the building, and we do have quite a bit of ability to do that still. And then there are some other steps before we'd contemplate getting close to the Evan Root Center.
Okay. The patient transfers, are they people with COVID, or are they critically ill with other illnesses? Is it a mix?
The vast majority have been patients with COVID. There's always capacity to consider transferring patients who may not have COVID if that's what's needed, but the true need in the system, the overwhelming pressure on the system comes from patients who are very sick with COVID-19, and those are the ones who are being transferred here and all about the province.
Okay, thank you so much for answering those questions. That's really important.
No problem.
Okay.
Dr. Salvatierra, you gave us a lot of data about the number of volunteers that are helping with the vaccination effort, the number of hours and the work they put in. Do we know the number of volunteers? Did you say that? I didn't hear.
Yes, I did. There are 145 at the moment.
All right. I think that's, did you want to, this week we should, you were seeing some decline now in those numbers, like in the number of close contacts and so on, but you think next week will tell the tale?
Well, I mean, what we're seeing in the last few days is a bit of a relief, Joelle, because it's nice to see that we're getting fewer cases, fewer high-risk contacts. I think what we want to do now is see this sustained going forward, and only time will tell.
Okay, I understand better now. Okay, thank you.
Okay, great. Thank you very much, Joelle. Let's circle back to Paul Rellinger. How is the mute working for you, Paul?
Can you hear me now?
Oh, we can hear you. Yes. Please go ahead and ask your questions.
Great. Well, great. That's great, because all I wanted to say was I have no questions. And I know that's a first, so you can mark that on your calendar.
No, you're kidding me, right?
No, we're good. We're good.
Wow. Okay, you're going easy on us today. Okay.
Well, part of my problem is my phone is dying, as you know, and I have no power here today, so I'm really trying to expedite things.
Okay. Well, and we do post a video of the of all of the briefings on our YouTube channel if you need to follow up with anything after the fact. So.
Perfect. Thanks.
Okay, thank you, Paul. So let's hear from Jessica Niznik from Global News. If you've got some questions for our speakers, go right ahead, Jessica.
Thank you, Brittany. Dr. Salvatierra, hello.
Hello.
Just maybe a quick update. Every week we talk about the shortages, and you said last week we were facing about 12,000 short in order to finish the 60 plus this month. Maybe just let us know where we're at with that.
Well, we have a meeting this afternoon. I have a meeting with the Associate Deputy Minister. So I will be going through our data with her and also seeking some assistance from her to address the ongoing shortage that we're experiencing. So hopefully I'll have some good news to share following that meeting.
Okay, I think we talked about that last week, where you're going to let her know that we have a large senior population, because you were saying it was some of the allocation was based on per capita, which is not working for us. And this one is for, again, a workmate who's doing a transit story today. And apparently there's been some issues, I don't know of them firsthand, with masks not being worn on transit. Dr. Salvatierra, can you just give me a quick reiteration of why masks are needed, not just on, well, we'll say transit for now, everywhere, but especially transit?
Well, especially when they're essentially worn as source protection. And that means that I wear a mask in order to contain my droplets so that I'm not spreading the droplets to others when I'm speaking, and I'm not contaminating the air or surfaces with high droplets. So that people wear masks to protect others. And so we are asking that everyone wear masks in any internal space that you're sharing with others. And we're also emphasizing the need for masks if you can't maintain that 2 meters distance. So for example, on transit, when people are moving about, that may not be possible to maintain that distance. So that's even more reason why we are asking all users to wear masks.
Thank you, Dr. Salvatierra. And just a quick question for Dr. Mikkola, if you're able to tell me. Dr. Mikkola, you said there's 17 patients in the hospital with COVID-19. Do you know how many are local?
I do not have that precise number. I do believe that the larger proportion currently are from patient transfers, but the exact number that are local and related to transfers, I do not have at this time.
No problem. That is it for me. Thank you very much, everybody.
Okay, thank you, Jessica. And thank you everyone for helping with the answers. Okay, I also see Greg Davis from Global News on the line. Did you have any questions for our speakers today, Greg?
No, not today, thanks.
Okay, great. So let's hear from Trent Radio. Rob. Sorry, Rob, do you have questions today?
Just a second, trying to figure out which button to press. Is Chief Gilbert on the line today?
I believe he is. If Chief Gilbert is able to speak and put his camera on, I can spotlight him. Let's see here.
Good afternoon.
Hi, Chief Gilbert. I just had one question for you. We saw over the weekend there was, on Friday there was, in the announcement that was made by the province, then there was new powers that were available for the police potentially. And then there was, I think in the end, every municipal police force in the province stated that they had no intention of using those powers, and it was walked back. Was there any consultation from the province that you're aware of, either with Peterborough Police or with any police forces in the province before that announcement was made on Friday?
Well, I can say that there was a briefing Friday afternoon where we heard about it, but we weren't consulted in advance. Here in Peterborough, there may have been other services that were consulted. Could have been the Canadian Association of Chiefs of Police or the Ontario Association of Chiefs of Police may have been consulted. I don't know. We were not directly consulted here.
Okay, great. Thank you very much. That's everything for me.
Okay, great. Thank you, Rob. Okay, so Bill Hodgins is also joining us on the line. So if you've got some questions for people today, please go ahead.
And I'm sorry if you may have covered this at the beginning because I was a minute or two late signing in. Last week, we were hearing, at least from one of the independent pharmacies in town, that they had close to 5,000 people on the waiting list. This was before they dropped the age from 55, but only a couple of hundred doses were coming in at a time. As that allocation, have you made any indication that allocation will be ramped up, boosted up now that 40 and over can get those shots?
No, I haven't heard whether we can expect more allocations based on the changes in eligibility, but that is certainly something we can take back and report back next week.
And given the demand, and if there's an opportunity to get a greater allocation, would there be possibility of just mass clinics for the AstraZeneca?
Well, public health has always maintained our interest in offering any COVID-19 vaccine. So I will provide any COVID-19 vaccine I'm given. And if we had enough to do mass clinics, we certainly would consider that. As you're aware, the AstraZeneca is a very portable vaccine. It is stable. It can be moved around as long as it's refrigerated. So it is an easier vaccine to work with than the messenger RNA vaccines, the Pfizer and the Moderna, which need to be kept frozen while you transport them and are much more delicate.
Okay, thank you. And I guess one question, maybe for the chief, I'm not sure. We heard about the incidents or whatever on the weekend with the protest. Since the announcement from the province, have there been any other problems in the community other than with the protests that has required the police attention?
I haven't heard directly about any other problems. However, we do continue to, I'm told, get radio calls, people providing information, and where possible, our approach is, as we said on Friday, we're going to continue to try and educate people on the new requirements. But as to specifics, I can't say. I know that we did lay some charges in relation to the protest, and there are further charges that are being laid as we speak in relation to that protest on the weekend. Not all of the charges were laid at the demonstration, and out of the abundance of caution, a number of those, it was decided to lay or to provide service to the alleged offenders away from the protest. So that continues as we speak. So we might have increased numbers of charges from that demonstration next week that we can refer to.
Excellent. Thank you very much, Chief. And that's good for my questions. Thank you.
Okay, great. I think we've heard from all of our media partners then. So with that, that wraps us up, and I'd like to thank you all for joining us. Thank you all for your efforts to help us keep our numbers as low as possible at this critical time. Special thanks to Dr. Mikkola for joining us today, and we look forward to seeing you back here on Friday. So stay safe out there.
Brittany, can I just, Brittany, it's just Lance here.
Oh, hey, Lance.
I'm sorry, just one quick question. Does anyone know if we have any patients in ICU at the hospital? I don't know if that was discussed.
Okay, that might be a question for Dr. Mikkola.
Yep, the answer is yes, we do.
Do you know how many, Dr. Mikkola?
I do. We don't generally share numbers by patient location in these media briefings for patient privacy purposes, but we do have patients with COVID-19 in the intensive care unit.
Can you say more than 5 or less than 10?
I will say more than 5.
Okay. All right, thank you.
Thank you.
Okay, great. Okay, I think that does it then. Okay, appreciate everyone's time today. So stay safe, and we will see you back here on Friday. Take care.
Thanks, everyone.
Thank you.